I'm Dr. Tanya. I'm a cosmetic dentist at Advanced Dental Artistry. I graduated from the University of Western Australia in 1998, so I've been a dentist for like 24 years. Veneers are literally facings on the teeth. So when we create a beautiful smile, we want to create that smile taking the minimum amount of tooth structure away, but also getting a great aesthetic result. So we take a little bit of tooth structure from the front of the teeth and we replace it with a porcelain veneer. Porcelain is a great material because it's stronger. You can also get a great aesthetic result and it also lasts longer. Generally say to patients, veneers last 10 to 12 years, and it really is dependent on how well they take care of the veneers and what they eat, and also whether they wear a night guard to protect the veneers when they sleep. We have a lot of patients where the veneers last 16 to 17 years, so they can definitely last longer than the 10 to 12 years. Some people, when they're looking at getting aesthetic work done, they are looking at alternatives, and one is composite resins. We call them tooth coloured fillings. And you definitely can use them to, get a better smile, but the only thing is that you just can't get the aesthetics because there are limitations with the shade. Also, they're not as strong and they also stain as well, and you definitely will be able to see the junction of where the composite resin is to the tooth. So that's generally why we don't use composite resins when we're looking at creating a beautiful smile. I generally say anything that stains a coffee cup will actually also look at staining the composite resins. So you're looking at tea, coffee, red wine. We say porcelain veneers take around about 4 to 6 weeks to complete. Usually that is like 4 to 5 appointments. 2 appointments are the larger appointments. This involves preparing the teeth and giving the trial smile where the patient gets their new smile. We then have 1 to 2 review appointments to make sure that the patient's 100% happy with their smile. And the next big appointment is the insertion of the final porcelain. We then have a review after to make sure that the patient's 100% happy with their smile. I think the main thing is to know the experience that the dentist has with doing cosmetic treatment. Also whether they work as a team with their technicians and whether when they do the design that they're really looking at the face and making sure that the design is in harmony with the face and they're not just looking at the teeth. Porcelain is preferred because it's a strong material, we can get a great aesthetic result, and also it can be really thin. It can be as thin as 0.6 of a millimetre. So it actually means that we don't have to take a lot of tooth structure away when we create a beautiful smile.
Wow.